Good afternoon, everyone, and welcome to this webinar, which is jointly between Future Care Capital, NHSX, or now the NHS Transformation Directorate, Ipsos MORI, and IPC. It's really exciting to see this research and have a good discussion amongst a lot of different stakeholders to think about the next steps and see where the sector is going. Future Care Capital has supported this research since the outset as part of the expert reference group. And as a bit of background to Future Care Capital, we're a think tank and innovation organisation that caters to health and social care. We focus on data, technology, innovation, investment, and climate. And our purpose is to imagine the future of health and care and see how we can take the current system to where it needs to go. This event today will be made up of a series of presentations and discussions, and we'll get to hear some of the real-world experiences of different tech implementations that were covered in some of the research. At the end of the event today, we'll have a panel discussion including Phil Nielsen from City and County Healthcare, Alison Toombs from North Tyneside Council, Nicola Murgatroyd from My Life Raft, and Thomas Tredinnick from AliCare. I'm very pleased to be joined by partners from the NHS Transformation Directorate, who will also be discussing how the findings will be supporting government policy and adult social care sector reform plans. Alice Ainsworth is going to do a short introduction in a moment, and she's the Deputy Director for Adult Social Care Technology and commissioned the research in the first place. So it'll be really useful to hear some of that background and where it's going next. So Alice, over to you for an introduction.
Thanks, Peter, and thanks for everyone for joining us. Huge thank you to the Future Care Capital team for hosting this event and for supporting the research that we conducted. So it's a really exciting time for us, really exciting time for everyone who's working in social care digitization at the moment. It feels like there's a really increasing, growing recognition across government and across the NHS and across social care providers that technology can really improve the quality and the safety of care. The work that we've done has really demonstrated that technology can support the care workforce by freeing up more time to care and also reducing time spent on administrative tasks. So we've spent a lot of time listening to the sector through this research and also through our engagement work on the recent white paper. So the Adult Social Care Reform white paper, People at the Heart of Care, was published just before Christmas. That commits us to spending an additional 150 million on digitization of social care over the next 3 years, which is a really exciting time for us. We've got ambitious plans and we're really excited that the enthusiasm is there across government for us to drive these forward. So as part of that, we're launching a new programme working in partnership with the integrated care systems and all of the key players involved, where we want to test ideas and scale technologies where there is a proven benefit. There is an evidence base out there, and we want to make it stronger and make it clearer where technology can really make a difference. And through doing that, we really want to develop that case for change. So as part of that work, we're also embedding enablers for digitisation into all of our programmes within the NHS Transformation Directorate, looking at how we can support digital infrastructure, cybersecurity, and also a digital learning offer for the sector to make sure that the workforce has the skills and confidence it needs now and for the future. We also said within the white paper that we would be publishing advice on what good looks like for social care as part of a blueprint. So we want to make sure that that's really practical and engaging advice and support for people to help them understand what technology to invest in, what's best for their business, what's best for the people that they are supporting. We're going to be providing some case studies of what's worked well, templates, decision trees, really sort of practical on the ground support to help people make decisions. And while there has been significant progress in recent years, we do recognise there's a lot of work to do. There's significant barriers that have come out through this research that we've conducted to help invest in social care technology. And we want to work through those challenges and understand what the role of government is in supporting the social care sector and industry to really invest in social care tech. So really happy to be here today to reflect on those issues and work with you all to plan what our next steps are going to be. We have got some work underway to respond to those review recommendations, which some of my colleagues are going to update you on later on in the session. And we're really looking forward to everybody's ongoing support and collaboration to help shape our programme of work and make sure that we're being as ambitious as we need to be. So thanks everybody for joining. Thanks to Ipsos and IPC for their work in developing this review. And they'll all be sharing the highlights of that with us today. Thank you.
Thank you very much, Alice. That was a really good introduction to the background of the work. And it's great to see so much research coming out on care technology, and both from the supply side and the demand side. So it's I think it all is fitting together really nicely, and the sector is really starting to get some good insights of where to go next. So our first part of the session today is a presentation on the research itself. So this is from Ipsos MORI and IPC. So Claire is going to be presenting from Ipsos and Fiona from IPC. And I believe you are sharing slide responsibility. So if I think, Claire, if you want to share your slides, and we'll get started.
Yes, can you see my slides now?
Yes, I can see those. Excellent.
Perfect, thank you. Right, so this review was conducted jointly with another review focusing on digital skills in adult social care. And there was some crossover between the two reviews. So to start with, I need to explain the objectives of the two reviews, the methods and audiences. Then I'll give you a very quick summary from both reviews before talking about the detailed findings from the technology review, and then Fiona will cover the recommendations. And by the end of this presentation, you will know what needs to change for technology to become more embedded in adult social care. So the objectives of the technology review were to look at the adoption and scalability of technology innovation in the sector, looking at the types of technology that are being used and by whom, the barriers to adoption and innovation and associated enablers, and then the issues around supply and demand. For the skills review, we explored digital capabilities of the social care workforce, looking at their current levels of digital skills, trying to get an understanding of future needs for digital skills, and looking at the current provision for learning and development and the outcomes of the trainings that people receive. The two reviews were commissioned by what was then NHSX, and they were delivered by Ipsos with the Institute of Public Care. And for the skills review, we also had Skills for Care on board. They included a large number of audiences: people with care and support needs, unpaid carers, members of the workforce, regulated care providers, local authority, technology suppliers, and learning and development suppliers. We did qualitative research with all these audiences, and we also conducted 4 surveys with the workforce, local authorities, care providers, and technology suppliers. And some components of the research were common to both reviews, so they covered both digital skills and digital technology to minimize the burden on the audiences. And then there were some elements that were specific to each review. And this slide gives you an idea of the scale of the review in terms of number of focus groups and number of depth interviews and number of responses that we received to the survey. So it was quite large scale. The two reviews took place throughout 2021. We started in January with a scoping phase that involved telephone depth interviews with stakeholders and a rapid evidence review that was conducted by IPC. And this scoping phase enabled us to refine the methodology, agree the exact objectives, agree the audiences that would be covered, agree the type of technology that would be looked at as part of the review. We conducted fieldwork between April and June, analyzed the data collected over the summer, and reported in the autumn. All the outputs are available on the Ipsos website, and there is a link to them at the end of this presentation. We also had input from an expert reference group at 3 key points during the 2 reviews, providing insight and advice, very valuable at different points. The technology review considered all types of digital technology used in managing, delivering, and receiving care. But for the purpose of conducting the review, we classified technology into 4 different groups. The first one, consumer digital technology or apps. This is typically smartwatches, smartphones, audio assistants, that kind of things. The second type was business support and care management systems, and they are typically things like digital care rostering software, digital social care records, and electronic medication administration records. Support and monitoring digital technology, they include, the typical example is a personal alarm, but it also included things like monitoring equipment with sensors or voice-operated or remote-controlled digital technology. The last, 4th type, was the what we call advanced digital technology, which referred to robotic digital technology, virtual reality application, and sensory digital technology. So we've covered objectives. Now I'm going to give you a quick summary of the 2 reviews. For the skills review, we found that there were positive attitudes about digital technology among the majority of the workforce, and a quite well-shared agreement that technology plays an important role in adult social care. But what limited digital skills and digital confidence was the lack of familiarity with technology and a lack of opportunity to use technology. So when people could use it and they got more familiar with it, it boosted their confidence and they learned new skills. There is a need for greater awareness, knowledge, and understanding of the care technology among the workforce and among people with care and support needs and unpaid carers as well. We found that the use of technology can generate anxiety, for example, when technology is first introduced or when systems are not user-friendly, when people get stuck and don't know where to ask for help. And we also found some concerns about the impact of technology on face-to-face care. And to reduce these concerns, then the learning and development support needs to build confidence around basic and transferable digital skills. The review also found that there is a need for a stronger digital leadership, in particular among care providers. So when we ask care providers to assess the digital maturity of their organization, only 12% of them rated their organization as expert. We also found that there was a need for support with change management in local authorities and care providers. And finally, the COVID-19 pandemic has increased opportunity to develop skills, but may have also increased disparities in the use of technology by staff in different roles. Turning to the technology review key findings, we found that the current use of technology in adult social care is widespread, but it's mixed, it's uneven. It varied by type and size of providers, and also some types of digital tech are much more commonly used than others. We found that there was a greater potential for digital technology to support independence and care delivery, for example, with wider adoption of support and monitoring technology. The large number of small and medium-sized care providers in the market can create challenges for digital implementation and change management. And the exact cost and financial benefits of digital technology were unclear. We found that there is a need for a clear vision and consistent standards regarding data sharing, for example, and interoperability. And finally, the COVID-19 pandemic has led to an increase in the use of tech, in particular communications technology. And this has helped people with care and support needs to keep in touch with family and friends, access health and care services. And for the workforce, it has facilitated remote working and sometimes care delivery or provision of some care services. And as people have started using more communications technology, they've become more aware of its benefits. And it's likely that the increase in the use of tech as a result of the pandemic will be long-lasting. So let's talk about the detailed findings from the technology review now. So a range of technologies were used by care providers. The vast majority of them had access to laptops, PCs, video calling software, mobile tablets, smartphones, and so on. And over half of them were using monitoring equipment with sensors. But this varied by type of care providers. And so if we go back to the 4 types of technology that we defined earlier on, care homes were more likely than home care providers to use support and monitoring technologies, i.e., for example, monitoring equipment with sensors. On the other hand, home care providers were more likely than care homes to use business support and care management technologies, such as digital care management software, digital care records, or electronic medication administration records. We found that the awareness and knowledge of care digital technology varied. So if we look at types of technology, for example, personal alarms and monitoring equipment with sensors were very commonly used and people were very aware of them. That was the most common, the thing that people were most familiar with. But advanced digital technology was far less common. Awareness and knowledge of the range of care technology solution available was also variable among the workforce and among care providers. So among frontline adult social care staff, the understanding of the range of technologies available to meet the needs of people they cared for, it varied significantly by job role. And so there were differences there. To give you some stats on this, 57% of staff with a direct caregiving role regularly thought about how digital technology can support the people they care for. It means that 43% of staff don't actually regularly think about this. And at care provider level, the large number of technological solutions on offer was also considered overwhelming. So we've got 47% of staff in managerial role with responsibility for digital development who felt their lack of knowledge inhibited their ability to use new digital technology to improve care. And if we turn to people with care and support needs and unpaid carers, with the exception of personal alarms, their awareness and knowledge of care digital technology was low. And many participants in the interviews, in the qualitative interviews, didn't know how they could benefit from digital technology, where to find out about existing digital solutions that could meet their needs, and where to buy them. So that was an issue. But what was very positive is that when people with care and support needs were using care technology, they were very positive about its benefits, mentioning that it had benefits around personal safety, security, peace of mind for them and their families, independence, and more generally making life easier. And this was especially the case for people who had been disabled for a long time and had learned to use technology as part of their day-to-day life. And we've got two lovely quotes here that illustrate these points. All types of technologies were thought to have clear benefits according to care providers who were using them. And the kind of benefits that care providers were mentioning related to better quality of care, improved health and well-being outcomes, improved productivity, and staff spending more time delivering care. These benefits relate to support and monitoring technology, and this is the type of technology that where the benefits were thought to be the greatest. And we've got here two quotes illustrating the benefits of digital tech in social care. Looking at the financial benefits of digital technologies, care providers held mixed views on this. About half, or just under half of them, so that the cost of consumer technology would be recouped through improved productivities and greater savings. But a slightly lower proportion, 42%, so that the cost of technology would not be financially recouped. So views fairly even there. But what is interesting is when we split the sample by looking at how digitally mature care provider organizations are based on their self-assessment, we get a different picture. So among care providers who rated their organization as experts in digital maturity, 66% feel that the cost of consumer tech would be recouped through improved productivity or greater savings. And it's the other way around when you look at novices for cost of technology not financially recouped. So there is hope there. And this pattern in the data could be found whatever type of technology that we covered. This data relate to consumer technology, but a similar pattern can be observed in the data for other types of technology. Looking at the barriers to the adoption of technology, we identified three main ones. There was variation in familiarity with technology and in opportunity to use technology in the workplace, and this impacted on confidence. So where there was limited access to digital technology, there was generally lower confidence in using tech and lower positivity towards it. The limited awareness and knowledge about the range of digital technology available is something we've talked about already. And digital technology suppliers considered that this mixed awareness among care providers and local authorities was problematic because they were their main clients. So in terms of scaling up and adoption of digital tech, that was a problem for them. If we turn to attitudinal barriers, we found some among some people with care and support needs and some members of staff, some members of the workforce. So, for example, technology could generate anxiety when introduced, or when people didn't know what to do when they got stuck, or when they were facing technical jargon or having to use systems that were not user-friendly. And this was found both among the workforce and among some people with care and support needs and unpaid carers. Other attitudinal barriers included, for people with care and support need, a perceived lack of need for digital technology because some people thought that their support arrangements were fine as they were, or they thought that introducing tech would be too disruptive, or that they felt their care needs were not sufficient to justify adopting technology, especially when this was thought to be expensive. And we've got two quotes here that illustrate these points. Turning to the organizational barriers to the adoption of digital technology, care providers identified many, the main one being budget pressure, but also digital skills of the workforce, 45% of them, a lack of time to focus on development and lack of infrastructure. Local authorities and technology suppliers identified also some barriers, and some of them are similar. The diverse nature of the care provider market and financial pressure in the sector, a lack of digital backbone for the sector to build on. And I'd like to talk about the first and the last one in more detail. So the care provider sector is predominantly made up of small and medium-sized care providers, and there are over 150 separate local authorities with adult social care responsibilities in England. And for technology suppliers and service providers, this was a challenge because there were challenges associated with low levels of in-house knowledge about technology, low average customer size, and low value order per customer. And so that was a problem for them. The lack of vision of a digital backbone for the sector. This related to inconsistency in systems and lack of interoperability, and so these limitations were a barrier to care providers and local authorities when trying to purchase digital technology and to digital technology suppliers operating in the market. And we've got two quotes here that illustrate these difficulties. Looking at the enablers to overcome the barriers that we've identified, we've split them by audiences here, but there is a lot of crossover between them. So if we take this first one for people with care and support needs, they need better signposting of information and advice about tech solution, but that is similar to some of what the workforce needs in terms of developing their knowledge on how this technology can help improve outcome and what are the different solutions available. And similarly for care providers, they wanted help to understand the different technologies available. If we take the second one for people with care and support needs, they wanted available hands-on support to adopt digital technology, learn new skills, and troubleshoot, which is very much about improving digital skills. That's an issue for concerning the workforce as well, who wanted support to further improve their digital skills and confidence. And similarly, care providers thought that the workforce would need to be upskilled. The last enabler for care providers was about support to improve project and change management processes. And that's also something that local authority needed. They mentioned something called change partnerships, and a few local authorities that took part in the research mentioned them. And these were typically a technology supplier and an independent change management consultancy specializing in digital tech, who were working with local authority and relevant stakeholders to source relevant technology solutions and support local authority in the culture changed during the adoption process. For digital technology supplier, the main enabler was about having a clear vision for digital technology in the sector with policies, data standards, and enhanced interoperability. We asked the audiences what they were planning to work on in the future. And for technology suppliers, they were planning to work on big data for 7 in 10 of them. So data use, data sharing, data management, data analysis. Local authorities and care providers, on the other hand, were planning to use more digital technology to support delivery of frontline care and support in back office functions. So for over half of them looking to adopt consumer technology and apps or business support and care management system. And it made us think that there is a need perhaps to realign plans from tech suppliers with needs from care providers and local authorities. Now we're going to hand over to Fiona to cover the recommendations.
Thanks, Claire. So my name's Fiona Richardson. I'm the Director of the Institute of Public Care at Oxford Brookes University, and I'll talk you through the recommendations. Now, the review research team proposed these recommendations, so there are independent recommendations, but we did test them with the sector as part of the development process, and we discussed them with representatives involved in the expert reference group. We think that the findings and recommendations, well, of both reviews actually, are hugely important to the sector, and the NHS Transformation Directorate will use them, and I believe have done so already, to inform their plans for adult social care digital transformation. And there are 6 recommendations, so I will talk you through, I'll take sort of 3 at each one. So Claire, if you could move the slide on to the first, oh sorry, you on the first one?
Yeah.
Thank you. Okay, so firstly, to enable more digitisation, we need a national vision for a digital ecosystem for technology in adult social care. And some interviewees described this as a digital backbone for the sector. So we need a national strategy for technology that encompasses what's needed now and looks ahead to where the sector needs to be in a few years and beyond. And importantly, it must include implementation of interoperability and best practice standards. Now, this isn't new. I know the TSA has been calling for this for a while, for example, as the consistent development of systems that allow extraction and use of data for prediction and early intervention, and which are consistent whichever supplier is chosen, means that they need to be fully interoperable. And we also suggest clarification on digital best practice for care providers and how they'll be assessed by CQC, together with clear guidance from local authorities on their expectations and the commissioning requirements that they want for the different types of care providers they commission, and a continued push on information governance or data protection minimum standards, particularly relevant for when care staff are bringing their own devices to work, and a continued support for the data security and protection toolkit in the sector. So that's what we mean by that national vision. So the second recommendation is around the market for purchasing technology. And as I'm sure you know, most care providers are small or medium sized, and there is therefore a fragmented customer base for the purchase of care technology. So we recommend that more support is needed to mitigate the impacts of that fragmented purchasing market. And strengthening of the care provider and local authority purchasing market would also be beneficial, as it would increase purchasing confidence and purchasing efficiency. and provide a clearer customer base to suppliers without making supply to the care market unaffordable for digital technology suppliers. And this could be done, for instance, through existing structures such as the integrated care systems. And thirdly, COVID has normalized tech, and there are some really great pockets of good practice, but it's not joined up, and it could be scaled up much, much more. And to increase uptake and buy-in requires much greater awareness and understanding of using technology in the care sector as opposed to in people's everyday life. And that's by all people in all areas and at all levels in the sector. So, for example, social workers and OTs on the potential of digital care technology to meet people's needs and how to choose it and how technology can support a strength-based approach. People with care and support needs and unpaid carers on the range of care and consumer digital technology available, how that tech can be used for their current and their future needs to maintain their independence or improve the quality of care or support the role of the unpaid carer. Leaders and managers in the sector on how to introduce digital transformation, where to begin and what tech can offer. And procurement teams on how to facilitate the introduction of innovative solutions that meet needs within existing procurement frameworks. And care workers on how digital technology complements and supports rather than potentially replaces face-to-face care, which is always a fear, so that they feel confident in adopting tech and in helping people to use it, and digital technology suppliers on the needs within the sector. So if I now talk you through 4, 5 and 6. So number 4, we've already said that we recommend developing standards, and it's important to point out that any standards that are developed should involve the end users of technology and be co-produced to actually reflect how people in the sector use tech. And any standards would benefit from building on currently available consumer digital technology so that technology is intuitive and accessible for end users, because it's like the kind of things we use in our everyday life. And people with care and support needs and unpaid carers and care workers would benefit from additional support to develop their current digital skills further. And there's much more on that in the skills review. The 5th recommendation is about investment. Now, technology has many benefits, but it can be sometimes hard to measure, particularly the financial benefits of investing in digital technology, and not everyone's convinced that it pays for itself, or that those benefits may be experienced elsewhere in the sector, maybe, and not in social care. So greater capital funding could be made available to help care providers and local authorities purchase digital technology, as they or the individuals who need to purchase technology themselves may not be able to afford to, or possibly can't make the short-term business investment case for that purchase. And lastly, we'd recommend that further research needs to be conducted. There's a constantly changing tech landscape out there, and we were aware that there are some areas that were out of scope of this review. So to cover those areas, so in particular, we recommended that more work is needed to explore the economic costs and benefits, so that cost benefit that I was just talking about of digital technology in the sector, and how digital confidence, digital skills, and the use of technology may be impacted by broader demographic factors such as ethnicity and socioeconomic status. Thank you. I'll stop there because I believe that we might have a few minutes for any questions.
Thank you, Claire and Fiona. And there have been a few questions in the chat, and so those of you in the audience, please do keep those coming in. A really useful one is from Louise, who is from Lincolnshire County Council. She's asked, "Hi, are the findings available broken down into different cohorts? I'm interested in the situation for autistic people, people with learning disabilities, and people with mental health needs." I'm going to add a little bit to that question as well. because there's a huge amount of information across the reviews. And I was wondering, is there going to be a follow-on analysis of some of that information slightly further down the line? So Claire or Fiona initially, either one of you.
Yeah, so I don't think we're planning to do any further analysis, but there are lots of outputs available on the Ipsos website where you can find all the data tables and all the cross-breaks available. We interviewed different types of care providers, and some of them were specializing on supporting people with learning disabilities and autism. And you can, we didn't necessarily interview enough of that subgroup in particular to be able to do some subgroup analysis and look at differences. But the data are available online, and you can actually see them for yourself. I don't think we've got any specific data on this from the interviews that we conducted with people with care and support needs. We did about 25 interviews, and some of them were with people with autism and learning disabilities, but not necessarily enough to enable a subgroup analysis within these 25 interviews.
Lovely, thank you.
Partly why we did the last recommendation, really, saying that we were aware that we couldn't get down to the sort of really granular detail that people might want to pick some of that data apart.
Excellent, thank you both. There's a few questions coming in that are quite focused on some of the next steps and the funding and the infrastructure available to implement some of these recommendations. But I think it might be best to save some of those for a bit later in the session when the Transformation Directorate give their update. So in the interest of time, because I know that we're very tight on time for this session, I think we might move on to some of the case studies. So the first case study is a digital prescribing for falls prevention case study, and this is from Emma from Urban Foresight. So Emma, if you're there, please do start sharing your slides, and we'll hand over. And please do keep all the questions coming in. There's some great ones coming in the chat, so we'll hopefully get to all of them throughout the session. So Emma, over to you.
Fantastic, thank you very much. Yeah, there is time for questions, so feel free to store them for when I finish presenting. I hope that you can all hear me okay, by the way. Do let me know if you have any problems there. And I hope that you can now see my screen. So firstly, hello, my name's Emma. I'm a senior consultant with Urban Foresight. We are a place-based smart cities consultancy, which is to say we do a lot of work in technology and innovation in public services. We were very privileged to be Newcastle City Council's innovation partner over a 3-year period from 2018 onwards. And as part of that, we supported the council in this activity for digital prescribing for falls prevention in reablement. And the slides I have here today are from the Alpha Pilot evaluation. So when we undertook this project, we used the Government Digital Services Service Design Manual standards. So we had a period of discovery, then we had an Alpha Pilot, and we're in the process now of laying the groundwork for the beta trial. In the discovery, we selected reablement for falls prevention. We knew we wanted to introduce some form of connected digital tools to the adult social care function in the council. And for various reasons, reablement and falls prevention were selected as the problem, which I'll give you more detail on now. So the government digital service approach is a challenge-based approach. So rather than selecting a technology to try and apply to the adult social care function, we looked at the challenges that they were facing, and we determined that falls are a significant problem in reablement. Over 40% of adults receiving reablement suffered from a fall either before their care package or during it, and this can cause problems with the development of frailty and reoccurrence and admissions and so on. So we wanted to see if, obviously, the function of reablement is helping people to live independently in their own homes over an intensive period. So we wanted to see if we could use connected digital tools to support more adults leaving reablement with low or no care needs, so living independently. And I think it's important to realise that we were doing the discovery activity over the course of 2020, right in lockdown. And we felt that we really needed to introduce digital tools that helped people to live independently and reduce the amount of service delivery that was happening in their home. So we looked at introducing different consumer technologies that could help support this outcome. We conducted a survey with service users, which confirmed that there was a need for a service that would help them to introduce connected digital tools and that they were interested in it. We were actually quite surprised by the prevalence of existing broadband connections in service users' homes, and we were surprised about the appetite they had for using digital connected tools on the proviso that they would have some support in using it. We also set up a form for monitoring falls in the service, which hadn't been done before. And in doing this, in recording falls instances, we identified 3 different common causes of falls, which is managing the intake of food and drink. So not staying hydrated, not eating enough, suffering from hypertension, and having a fall was very common. In safely navigating the home, we found that people's homes could be cluttered or dark, or that they were having to overextend to complete a common task or something like that. And finally, we found that often people entered reablement after having a life change, and they were less certain about the levels of strength and balance that was available to them. And it would be important for them to complete exercise to learn a bit more about the range of information they have and so on. And we did a technology scan and selected those 3 different technology solutions that we felt could help people to address these problems. So we wanted to use voice-activated assistants or smart speakers to help to remind people to eat and drink. We wanted to introduce safe lighting, so that's lighting that is triggered by a motion sensor or by a remote, to reduce the amount that people are moving about in the dark or overextending. And finally, we wanted to help people with an exercise program or activity program. Could we use some of the video calling tools that we knew were out there and we knew that people were using to do that? So in the process of doing this pilot, the reablement team experienced challenges in these areas. The skills and installation of the technologies was a big barrier. A big barrier was 2-factor authentication logins. Connectivity in the home was often a problem that the staff struggled to resolve. We found it difficult to recruit participants. Many of them felt that the offer was like a little bit too good to be true, because for this pilot we purchased the technology and was offering the service for free as it's an alpha trial. We found that the staff availability caused a problem during this time because we had pandemic measures and staffing levels underway, and also we found that shift patterns of the different staff caused problems. And finally, stock control was not a process that the staff were used to, and it was time consuming and a challenge for them to firstly learn how to manage a distributed stock of equipment, and secondly actually do it. But that's not to say it was all bad. There were lots of opportunities that we saw from the staff, really embracing the trial and going in there with all their energy. So we found that it was exciting to see sort of the organic creation of interfaces with other services. So physiotherapists took to programming in their exercise schedules in the Amazon Echo shows that we used. We found that a bonus of the connected digital tools being relatively new to people was that it was very quick for them to decide if it didn't suit them. So it was a very easy task to just deinstall, and no time was wasted there. The reablement team definitely developed some skills in, learning how to interface with these devices and support people in using them. We're particularly proud to see that some members of the team who had higher digital skill levels were able to take responsibility over managing certain aspects of the trial, and that opportunity wouldn't have been available to them without the trial. And finally, the pilot helped the service to understand more about where they add value to an adult's experience of using connected technologies. So their weaknesses in, helping to manage install and connectivity were balanced out by their strengths in helping to support adults in using the technology to meet their goals and, applying it to the tasks that they want to apply it to. Ultimately, none of the trial's participants suffered from a fall, and, the reablement staff concluded that the technologies improved across all of the expected outcomes that we anticipated them improving across, and that these benefits could be directly attributed to the trial. This is some of the results of the survey that we conducted with the staff members afterwards, and you can see that everybody agreed with everything, all had a neutral response. Here's a case study within a case study for you. Edith was one of the participants of the trial, and she was an absolutely excellent participant who took to using the technologies in various ways, and it was very heartwarming and reassuring to see her experience sort of play out over the weeks that she was involved in the trial. So she'd recently suffered from falls that reablement suspected were caused by her not managing her oxygen levels. So they decided to move away from the rigidity of the trial, but use the Amazon Echo Show to set up the voice assistant to remind her to check her oxygen levels. And having done so, Edith then ran with it and set it up to remind her to have a drink and to do various different things. The reason Edith took to this so well is because she was living alone, but because of her falls had reduced her confidence in living alone. And her daughter, who's her informal carer, actually lived south of the river and was sort of 20-minute drive away, so was unable to go around every evening and help Edith with tasks around the house. So in her reablement goals, Edith wanted to, be able to do housework by herself, and actually recorded that she wanted to be able to hang up laundry by herself. So she set up the Amazon Echo Show on her own to remind her to do some exercises and strengthen her upper body doing these exercises, which really helped. She also used the NHS Advice service that's embedded in the Alexa to ask for guidance when she had a nosebleed. And in this photo, you can see that she participated in the proof of context trial, where we tested out a member of staff from reablement calling up an Echo Show to have a video call with an end user in their home. And Edith's daughter was then set up to be able to have these video calls with her. So rather than having to drive through on an evening to check on her mother, she was able to drop in on the Echo Show. So both of them, both Edith and her daughter, had an excellent time on the trial, loved using the Echo Show and the smart lights that we set up as well, and felt that she was safer in the home because of this, and that she was able to progress towards her goal of living independently and being able to do her own housework thanks to the technology. So it was really lovely to see. And last I heard, they were in the process of looking into connecting it to a smart TV as well. So that's just one sort of human experience of the trial. But ultimately, the experience of the local authority is what we want to focus on here. And the recommendations and lessons learned that we've found from this trial are sort of distilled in 4 key points. So the first, ultimately from the process evaluation, is improve, don't invent. So the reablement team really excelled at providing services that were most aligned and most common with their existing skill set and value proposition. So they were very good at identifying where a technology could help somebody, supporting people in using that technology to meet their goals, and interfacing with other services and arranging a care package that included the use of this technology. New services, including the installation, maintenance and stock control, were a challenge and a barrier and ultimately were inefficiently delivered. However, they have an existing delivery model that is very similar for telecare services, where a third-party organisation manages the install, maintenance, stock control and billing of technology equipment for telecare purposes. So surely, instead of inventing a whole new service in the reablement team, why not improve on that current delivery model to include new technologies? The second learning was dedicated staff resource. To be able to scale this, they will definitely need a dedicated staff member to be appointed as a project manager. This must be an individual who, has the skills and training to use this technology, a regular shift pattern and the time available to, overcome any disruptions and really drive the scaling forward. The Alpha Pilot was extremely useful in helping to learn about what different technologies work and what different technologies don't. And it goes without saying, it was a very, very light touch pilot. It happened right in the middle of lockdown. There was quite a small selection of participants, but they learned very quickly and very easily that the Amazon Echo Show was a very successful technology option. The Philips Smart Hue lights were overly complex for the applications that they wanted to pilot for. So the lesson learned there is whatever technology you're wanting to introduce, an Alpha Pilot is an excellent, a small scale Alpha Pilot is an excellent function for figuring out if that should be used. So we would recommend going forward to do that. Finally, monitoring falls. Prior to the discovery activities that preceded this trial, there was no formal process for monitoring falls. To gather data on the outcomes of this project, we introduced a dedicated falls record form, and we think that this should be maintained because we learned a lot throughout the process. And also on an individual sort of case management scale, insight into the history of an adult's falls occurrences will help with delivering appropriate care. So that is a very quick overview. I know those slides were very wordy, so if you didn't catch everything that was on them, you're more than welcome to drop me an email. There's my email address, and I will share them with you. And I know that the council couldn't be here today, but they're very pleased to be involved in this project and are hoping to drive it forward with a scaled beta phase. So great. Allow me to stop sharing my window now. And if you have any questions, feel free to raise them.
Great, thank you very much, Anna. That was fascinating, and it looks like a really good trial. There's a couple of questions about some of the design of the trial. Sure. So firstly, what was the timeline overall for that trial, and also was there a control group to compare outcomes with?
Yeah, absolutely. So both very good questions. The timeline was quite difficult to define because they kept on setting it and then lockdowns kept happening and various things obviously over the course of 2020, 2021. Ultimately, we had the discovery phase from about October 2020 to about February, March 2021. And then we had the Alpha trial from around April to autumn time, sort of September, October in 2021. So it's a good few months for both of these phases, but that was, the nature of the team and their delivery and the relationship that we had. So yeah, and for a control group, we, in the discovery phase, we ran a survey and we monitored falls for a 3-month period. So we had a snapshot of, what would we ordinarily expect in reablement care packages? How many falls would we ordinarily expect?
And have you got a bit of an impression of what that was as a comparison?
Sure. So as I said, we found that 41% of people undergoing a reablement care package either had a history of falls or experienced a fall whilst they were going through reablement, and in the trial we experienced no falls. So I'm reticent to say that's a 100% decrease, but yeah.
It sounds like a fantastically successful pilot and alpha phase. Is there going to be a beta phase and adoption, and where's it going long term for that piece of technology?
Yeah, we really hope so. I mean, we were overwhelmed by how well received the Amazon Echo shows were. We had people who had never even heard of voice assistants take to them and really enjoy using them. They supported outcomes across the board, even helping people with sort of loneliness and social isolation, let alone, you know, making sure they drink enough water throughout the day. We had people using them for accessing recipes, listening to music. People really touched them. So we definitely want to try and scale offering support and people using that kind of technology in their reablement care packages. What we want to try and do is do that with a delivery model like I described, that's not a completely new invention, that's something similar to the sort of strengths of the different delivery partners that they have at the minute, replicated in the beta trial. So that's the intention, which is lining up all our ducks at the minute.
Lovely, thank you. There's a couple more questions for you, but I'll probably send those over offline for you to follow up separately, because time is very tight. So thank you very much, Emma. And if we move on now to Annie and Michelle from Kirklees Council. So they're looking at respite care home technology. So Annie and Michelle, are you there? And please can you share your slides?
I'll just share my slides.
Lovely, thank you. And please keep the questions coming in. There's some really good ones there. And we'll get to them all eventually, whether today or offline.
Fab. Okay, so hi, I'm actually Michelle Thomas, and I'm the team manager for Cherry Trees. And I'll hand you over to my colleague, and we'll be sharing the presenting today.
Hi, I'm Annie Pickering, and I'm one of the service managers who works for Kirklees, supporting our in-house provision. Our provider services, we started work on a vision around what we needed to become over the last 5 years and before COVID. But obviously, we've all learned a lot through COVID, and we wanted to pull some of that learning and some of that actually digital intelligence and infection control type things into our ambition and strategy as we moved our in-house provision forward. Our aim is to become market leaders, excellent in providing care services, and do justice to the communities we serve, achieve the outcomes which they deserve. Our intention was to do this using our own unique position, being innovative, taking a leading partnership role, and being flexible and responsive. There were kind of 4 key drivers behind the changes that we made to Cherry Trees, our respite unit for adults with learning disabilities. The first one was to make adult social care vision a reality by striving to be outstanding, leading by example and sharing best practice. The second was to incorporate technology into our improvements to environments and the use of assistive technology. We also wanted to look at the working practices of staff as well and improve some of the learning gained through the pandemic. We knew that a lot of people that were due to be transitioning into our adult services over the next 10 years have got profound and multiple learning disabilities. So we're responding by updating the environment and technology to allow us to provide more personalised support. We also acknowledge that we need to attract and develop and retain a highly motivated and skilled workforce through providing an excellent working environment with new ways of focusing, of supporting service users, focusing on technologies and use of technology. Our overarching outcomes around the use of IT are about care, connecting, communicating and collaborating. Our investment in AT aligns with each of these help me statements in our approach to assistive technology and technology-enabled care. The developments in our buildings and technology are compelling us to think differently about the service environment and make sure that the use of AT is informed through the lived experience of our service users and considered in the context of quality of life, experience and outcome metrics as opposed to efficiency metrics. I think somebody touched on before that it's very difficult to put a value on it's very difficult to measure that value, isn't it, in a kind of formal way. We want staff to continue to use AT in line with and to enhance service user goals, and we're already building up a range of case studies evidencing the positive impact that technology's had on people. I'm going to hand you over to Michelle to discuss the unit at Cherry Trees.
So hi, these are just some of the pictures of Cherry Trees as it is now, because we had an extensive refurbishment with all this new fantastic technology. So I think one of the first things was the brightness of the unit and the space, and having floor to ceiling windows and bifolding doors have really helped with that. They give service users a sense of space and calmness, which has been a massive help for them. We have a sensory bathroom which has got quite a lot of assisted technology. The bath there, for instance, plays music, it has lights, it has jacuzzi. Service users can hook that up to their own phone and play their own playlist on it. It is actually quite remarkable. We have the sink that you can see in the bathroom. It moves up and down. You can move it manually, but you can also remove it remotely, which means people can actually assist themselves independently. They don't actually need anybody there to do that with them. The garden space has been a significant change for us. So we've got swings for able-bodied people and wheelchair swings as well, which has been really great for a lot of our autistic service users that come that like to be connected with their own bodies, and the sense of swinging and rocking has been really soothing for them. We have the immersive room picture, which just to give you an idea of what that immersive room would look like. But we do actually have a video that will give you a true sense of Cherry Trees and our service users and the benefits that they're receiving from all the new assistive technology. So if we could just share the video, that would be great. It will give people the opportunity to be completely independent in certain aspects of their own personal care and their emotional and their well-being. So we've got equipment like this, like new swings, we've got sensory swings, ooh, yeah. We've got a fantastic potting shed. We're wanting to be able to grow a lot of our own vegetables, which we would not have been able to do before. We've got a fabulous sensory bathroom, which is such a big space, which will create independence, it will create dignity.
We can play music, there's speakers all around, so they can choose what music they'd like. They can deal with their own personal care, and it's so that they can maintain that independence throughout the stay. There's also a bath which is a sensory bath, and it's also a jacuzzi. It's encouraging their independence and definitely their dignity and their privacy.
We've got an immersive room which is absolutely out of this world fantastic.
My God, oh my.
It's amazing, isn't it?
Yeah.
It's a lot different to what it was.
Yeah, than what we used to. So.
I think it creates a lot of opportunities for socialising with other people and building up meaningful friendships.
Everything's brilliant so far.
Yeah.
Can't wait till end of August now.
Michelle, are you there?
Unmute. Sorry, I wasn't unmuted again. Apologies. So yes, so the equipment that we've invested in, as I said, it's the immersive room is a fully immersive environment. We have sound, vision, smells, it's temperature controlled, and it's a completely interactive experience. The sensory bathroom is about promoting independence. We use the adjustable equipment for service users to try and encourage a more positive experience when performing personal care tasks. The garden room is really about bringing the outside in. It's a quiet space, it's a safe space that we use as a breakout room for people that's behaviours are escalating and could possibly end up in in some aggressive behaviour. So we have that space, we have floor to ceiling bifolding doors, so we can open them right up and make sure that service users have a lot of space to access the garden and coming in and out of that space as they need, really. The garden swings, we've got a gazebo, the potting shed, the outdoor, we have got outdoor power, so we can put lights upon there. We can use some of the portable sensory equipment that we've bought, like the LED lights, things like that, and we can use those outdoors as well, which are really great for in this, for in the nicer weather, to be able to create nice calming spaces. All the new equipment has got service user friendly speakers. It's all linked up to service users on smartphones or tablets, so they can listen to their own playlists, videos, YouTube, things like that. We have touch control lighting, so service users can actually adjust the light and brightness for themselves. And we've just invested in a new call system, which is allowing us to be in contact with service users, but without disturbing them, particularly at night. It's been quite beneficial. So when we're talking about benefits for service users, what this has done is everybody's support plan is now reflective of the technology that we've got and how service users interact with that and the benefit that creates for them. So all staff and people that are working with our service users know exactly how to use that technology for the best outcome. What we have been able to do is have themed weekends, which we do nearly every 6 to 8 weeks, which are indoor and outdoor. So a recent example of that was we did a grow weekend. We was donated trees, and we was having that experience of why things grow, how they grow and why we do it. So we was having a practical experience out in the garden, using the potting shed, growing fruit and vegetables, growing herbs and apple trees. And in the afternoon, we use the immersive room to create that same experience, but for people that have got multiple physical and learning disabilities. So we set up a walk through a forest, and we used the wind machine. We set the temperature. We had the smell machine going, and we also had some physical things like leaves and soil, so people could have that interactive experience, which it was really successful, and the feedback we got was phenomenal, really. So we're going to continue with those. So I think some of the other major benefits is about the engaging with the individuals to support them to cope with anxiety or distress or behaviours that can be seen challenging. This technology really helps us with that. As a team, we're working with services whose needs we would not have previously been able to meet. So just some examples for that for you is that we have an individual that had displayed some quite extreme challenging behaviour, who wouldn't have normally been able to access our service, but now we have the space, we have the breakout rooms, and we've got the technology to help calm her anxiety and de-escalate that behaviour. She's had a really successful transition from children's into adults. We have another individual who's who's got multiple and profound disabilities and deaf and blind, who can only really communicate through frames of reference or objects of references. So the sensory bathroom in the garden has had a massive impact on their quality of stays and how they can sensorily interact with other people. We've also got a young lady that has very severe cerebral palsy and never actually gets the opportunity to rest. This causes her to be very physically tired, and it does actually cause her sometimes to go into seizures because she has epilepsy. So the sensory bathroom has been a real benefit for her. It's the only time that she can use the sensory bath in a way where she can exercise her muscles in a certain way and then actually have periods of rest. So she does feel quite rested and relaxed after that, and it has reduced her seizures as well. with the muscle therapy. It's really helped her with her muscular and skeletal development as well. She finds that such a positive experience. And it's a part of our objectives every time that she comes in to stay with us. So other outcomes and benefits is, I think, that has been throughout this whole build through lots of consultation with the companies that we've used, and liaising and reaching out to other establishments, is that we've had few challenges during the implementation. As staff and the service users felt well prepared for the changes, and was really excited for that moving forward. Staff were trained, they had really good training packages, and they are now fully confident with the benefits and how to use the new technology. So I had a staff team that was very reticent about technology and felt that they didn't really understand it, to now being, now we've seen the benefits of it, we're actually quite proactive about technology and looking at how we can use it in the future and what other things that we can use as well. So staff are much better motivated now. We've got morale has improved immensely because we have the environment. It's more conducive to help manage the behaviours that we need, that we are dealing with on a daily basis, to prevent escalation of behaviours, prevent incidents, prevent lashing out and violent attacks that have happened in the past. So I think staff have a real sense of, because we've got the space and we've got the technology to deal with that, the stress has reduced massively for the staff team. And I think one of the other biggest advantages and outcomes for us is that we've liaised and linked with social work teams. We've had them come up, we've had schools come up to look at the environment and the facilities that we have. So we're now getting much more appropriate referrals via the care management colleagues. So they're referring people who they know we can meet their needs. So it's using our service in a much more effective way. We have had a lot of engagement, as I said earlier, with schools and other partners. We've actually had lots of links with our local community as well. So they're very much on board and supporting us, and they've been a part of this journey of reopening and using some of our facilities also. And we've liaised with lots of other providers, special schools, private schools. We've had people like the Huddersfield Giants, one of our rugby teams, that have come up because they're wanting to consult with us and liaise to provide these kind of resources for some of their projects that they're working on in the community. So we've had that a real good opportunity to sort of work with people and say, do this, do that. This has worked really well. That hasn't worked as well as what we thought it would. And to share some of the case studies that we've had as well for some of those benefits. So it's been a really positive experience for us.
I'll jump in, Michelle.
Okay.
Kirklees, as a council and our in-house provider services, we are looking at further tech-related projects and improvements ongoing. All the AT and IT incorporated into the Cherry Trees scheme is being taken forward as learning for other capital schemes across different user groups. We're looking at a new learning disabled day centre, dementia day centres, and improved facilities in our larger residential homes. We've also got a proposed centre of excellence, which will showcase AT and IT that people can use in their own homes. You know, the voice activated types of things, clapping activated lights, but generally supporting the agenda and of helping people to live well for as long as possible in their own environments. The call systems that we've got in Cherry Trees, we're having similar installed into our other residential and day centre settings, motion sensors, preventing the need to go into bedrooms unnecessarily, those types of things. We've increased the use of epilepsy monitoring equipment and the use of immersive rooms, sensory equipment, lighting and sound systems. We're trying to take across our whole, all of our in-house provision, really, with working through to improve based on what we've learned and how well Cherry Trees has gone. So that's us. Thank you very much. Apologies, I think we may have gone over a bit of time.
Thank you both very much. And yeah, we're a little over, but I'm sure we can make it up a bit. I think in the interest of time, we'll probably skip some of the questions and get people to follow up with you afterwards. But I will say that there's been some very positive and warm comments about the video in the chat. So just wanted to reflect those back to you. Next up, we have Emma and Joe from the NHS Transformation Directorate, who are going to give an update on the next steps and some of their impressions of the findings. So, Emma and Joe, over to you.
Hi, I hope everyone can hear me. Can I just check, Peter?
Yep, all good.
Thank you. Hi, so I'm Jo Chandler, and I'm head of the Digital Skills, Care Tech and Innovation in the Adult Social Care Policy team in the NHS Transformation Directorate. I'm going to give sort of opening to the presentation, and then I'll hand over to my colleague, Emma Harris, who's the Assistant Director of our Digitising Social Care Programme. Okay, so just quickly, so we're in Alice's team who helped introduce the session, and the NHS Transformation Directorate, in case people don't know, was formerly NHSX. So with a joint unit that brought together teams from NHS England and the Department for Health and Social Care to drive digital transformation of health and care, aiming to achieve an integrated central approach to adult social care digitisation. We worked through a strong basis around partnership working and collaboration with our stakeholders. And it was just really exciting then to hear the case studies just now. So thank you for showcasing your work with us. We know that digital transformation can really improve the quality of people's lives, as just shared, and the right quality and the quality of care that they receive. It also supports our aim for people to have the right care in the right place at the right time. It helps people have confidence to remain in their homes and communities if this feels right for them too. And as we heard from Ipsos MORI and IPC with the review, we really want technology to help realise these opportunities, and we know about all the challenges. So fundamental to this digital transformation is the human side of technology, the people that we're providing services for and who we're working with. So users, their families, unpaid carers, and all the social care workforce. It's a really wide range of people. So overall, in terms of digital exclusion, there's up to 20% of the UK population actually lack basic digital skills or still do not use digital technology. So we really need to keep these challenges in mind as we seek to maximise opportunities. Our Developing Work programme seeks to respond to these challenges and the barriers that have just been outlined in the review research. Part of this collaboration is really crucial in taking forward all our plans to help shape the future policy direction on adult social care digitisation. So just moving quickly to our progress so far. Since our inception in 2019, we've delivered a wide range of projects to help drive this digitisation of the social care sector, including targeted work to support the COVID-19 response. So work, as you can see here, has ranged from improving access to connectivity and hardware, offering discounted telecom offers and provision of iPads, onboarding social care services onto secure email systems, with over 14,000 care settings now using NHS Mail. We're supporting social care access to health data through GP Connect and proxy access for care providers, and helping shape the direction of NHS strategy by embedding social care in the recently launched strategy on data. And we're evidence gathering to help shape our future work, including the tech and digital skills review we've just been discussing and recent research to support digital switchover preparations. So Alice touched on this earlier. So this is the government's white paper published just before Christmas, People at the Heart of Care, which set out a 10-year vision for social care as well as more detailed plans for the next 10 years. One of the things we really wanted to emphasise here is in writing our contribution, the technology parts of the white paper, we just kept collaboration at the forefront with stakeholders helping shape and challenge our ideas throughout this as we drafted it. And this is a process we want to keep continuing here. And this is really clear feedback from the reviews as well. Alice talked about the investment for 150 million in this, and funding will help support adoption and scaling of our digital systems. We're aiming to help at least 80% of care providers have digital social care record systems by 2024, supporting health and care integration. And putting people at the heart of care means putting them at the heart of technology and digital transformation too, supporting them to purchase and use technology that best supports their goals and helping people to live the lives they want. We've already heard how technology is changing lives. We know at least 1.7 million people in England already use assistive technologies, such as personal alarm systems to support care and give more choice, control, and independence. Many people use smart devices to help them with routine tasks, such as medication reminders, and sensor technologies are increasingly used to monitor movement and identify falls at home. Digital technology is making the provision of social care more efficient for the workforce. E-rostering solutions reduce administrative demands for care managers, and adoption of secure email through the rollout of NHS Mail to care providers has helped health and care professionals communicate more effectively. Similarly, we've got digital social care records improving transfer of care and handovers between shifts, ensuring staff have up-to-date information about people's health and care needs. And these systems can enhance the quality of care and free up time for meaningful human interactions. But onto the challenges. We know currently only 30 to 40% of care providers are fully digitised. So I'm going to hand over to Emma, our head of implementation, and she'll talk through our programme of work for supporting digitising the social care sector, which supports many of the recommendations just outlined in the reviews.
Thanks, Jo. It's always good when you get handed over at the challenge point. So as Jo said, thank you very much. I'm Emma Harris and I'm the Assistant Director for the Digitising Implementation team. So what we're trying to do is ensure that we've pulled together a package of work that means that we're able to help support the sector in the best way forward. We also recognise that from the information that was within the white paper, we need to ensure that we have got the basics right, that we're not only just looking to implement schemes that will help test care technologies, including that falls prevention work that we've been mentioning, but also that we're helping support care providers with a digitised care record, taking them on that journey to understand the value and benefit through the investments of technologies into the implementation and the approaches that can be seen within a care home. But without any of that, we won't be able to get the basics right without understanding the basic infrastructure. So ensuring that we're supporting the care sector with connectivity and the understanding of the importance of Wi-Fi. It's very well and good to have an amazing digital social care record that's been implemented within a care home, but if it's a Victorian building and in Bell's room at the back you can't get any Wi-Fi, we're not going to be able to help support people in the best way forward. So how have we done so far? We launched earlier on last year, well, at the end of last year, what was known as the Unified Tech Fund. So that was looking very specifically about being able to enable some key areas that we were looking to support within the white paper of obligations and also within the winter plan. So we talked previously about the infrastructure. How can we make sure that that is there in order to enable that digital levels of care? How can we put things such as acoustic monitoring that will reduce the frequency and severity and cutting hospital admissions? And we know that falls prevention technology costs the NHS over £5 billion a year, and £2 billion of that comes from the care providers. So by ensuring that we're implementing technologies that can help support that, there's a benefit to both sides of the equation. We can also see that by implementation of a digital social care record, we're able to save up to a week's worth of care time per 1 year's worth of care time per week. So what we're looking to do is ensure that these approaches are working together across our ICSs. And at the moment, we've been working with 14 as part of this first stage. So we now have a program. And within that program, we recognize that we're going to need to be responsible for different areas of delivery. So we know that the national team is going to need to help support, create that evidence base and ensure that we've got the benefits that we need. We know that we're going to need to have an assured list of suppliers, not just for digital social care technology, but also understanding the roadmaps that are going to be needed to implement that in order to achieve that interoperability that's been spoken about by some of our previous talkers. We also know that we need a minimum data set for adult social care, so we can start looking at regulation and developing Commissioner guidance to ensure that the sharing of information can become seamless between our social care sector and our health. We know that there'll be needs for provider guidance, that there'll be tools and templates that we'll be able to create, and that we'll continue to evaluate the support that we are providing to ensure that we are informed for our support for future years. But as part of that, I've got a team that are going to be looking at how those pieces of technology are implemented and how we can have equality and equity in the access of it, ensuring that we're sharing information out with the ICSs, and ensuring that the team of people underneath me are helping to develop those digital social care projects, helping to pull together their partners across an ICS within a local authority, within the NHS, within the social care sector, and working together on that journey to be able to understand the implementation of a digital social care record, but also how that interoperability can work across multiple areas. And then by contributing and creating those benefits cases and things like digital playbooks, we'll be able to evaluate the support that we've been offering. So within each of those areas, I've called out the key themes that the team are going to be available to help support on. So we'll have supporting the adoption of care technology. There'll be implementation of defined support offers for our care providers. We'll ensure that the ICSs start to understand the care sector and how to be able to interact with them and support them further. We're going to have supportive subgroups, which will start looking at the key themes and challenges that are being brought to us by our ICSs and our care providers, so that where we can use holistic hive knowledge across the country, we can start sharing the approaches. We'll also be looking at oversight for those supportive technology solutions. So whereas I've called out falls prevention, we understand there'll be another area of care tech that we'll be able to help support. We'll continue to help advise and guide on proxy access. And above all of this, we'll be collating and monitoring the data to ensure that every implementation and support that we're doing is providing the best level of benefit for the team. So across that, we have plans, and within those plans, we've made sure that we are not only going to be able to support an individual to manage their own care, that we can make sure that families have the confidence in the technologies and what's being used, that the carers and the care providers can have the right information when they need it, wherever they need it, and wrapping around that the correct information governance that ensures the correct parity of access for those workers. We want to make sure that working within a digital social care records, there'll be embedded decision support that can alert the care manager. And we also want to ensure that those connections between the NHS and social care can start to be shared wider, whether we're looking at a GP practice, a hospital, or even in someone's home. Jo, over to you.
Thanks, Emma. And just want to say, just quickly as we sort of finish here, just many thanks to Ipsos MORI, IPC, the case studies, and everyone here involved in the review work, NFCC, for hosting this session. We're already making progress in response to the review research and recommendations, and I hope that sort of gave a good sort of whistle-stop tour for what we're doing at the moment. But it's just the start for conversations. We want to continue, and we want you to help develop further our policy and delivery plans over the next 3 years and beyond. So we're really looking forward now to hearing the panel discussion next and hearing this continuing conversation. But please reach out to us if you want to share your ideas with us. Thank you.
Thank you both very much. There's a lot of support in the chat and from the questions, and a lot of the questions that were asked, you actually managed to address through the presentation as you went along. So I won't go into those in too much detail. I'd like to reassure everyone in the audience that the slides for the sessions will be shared afterwards, so you'll be able to go through those. And I'm sure that everyone in the audience will be keen to get involved in the next steps and help with the Transformation Directorate to put a lot of these recommendations into action. Okay, so we're on to the final session of this afternoon, which is a panel discussion. So if we could have Phil, Alison, Nicola, and Thomas, we'll get stuck into the discussion there. So what we're going to do is have a little introduction to each of the panelists, and then we'll go into a few questions and a bit of a wider discussion. So please do keep those questions coming in the chat, and we'll get to those in due course. So if we start with Phil, would you be able to give a little bit of background about yourself and what you've been doing at City and County Healthcare?
Yeah, can indeed. So yeah, I'm Phil Nielsen. I'm Head of Digital Transformation for City and County Healthcare. Been in the industry for 14 years, 6 of those with City and County, where I'm fundamentally responsible for advancing the operational model further down the digital platform. We've already taken it from paper to digital, and further enhancements on that as we progress forward.
Lovely, thank you. And over to Alison.
Thanks. Hi. So I'm Alison Toombs. I'm the Assistant Director for Assessment and Wellbeing in North Tyneside Council. But I've also been very involved in ADAS, and I have a lead role in the digital role for ADAS. So we've just started a national network on digital and technology for adult social care nationally, which I chair. And I also chair the North East Regional Network, which again is a relatively recent development. And the aims of those two is to really make sure that we share key learning from across the nation and from our regions, to make sure that we are getting a more consistent practice in social care in relation to using technology, in relation to the digitisation of sharing of care records, and in relation to understanding and using intelligence and data for decision making. Just on a local basis, we have a strategy around support through technology, which is this is in North Tyneside, which is something we're currently implementing. So there's a lot of kind of connectivity in terms of making sure we're getting good learning and better consistency of practice across adult social care through the networks that we've been developing.
Lovely, thank you, Alison. And Nicola, over to you.
Hi, yes, I'm Nicola Murgatroyd, CEO and founder of a company that develops digital products, and we focus on supporting healthy aging and those with a long-term condition, and promoting self-driven healthcare. My work history prior to doing this project was in patient-based clinical trials and in breaking down silos of information. If anybody wants to know anything else, just ask.
And Thomas, last one.
Oh, hi everyone, I'm Thomas.
Yes, sorry, I think my internet.
Sorry, Peter.
Keep going, Thomas. Don't wait for my internet.
So I'm Thomas. I'm CEO and founder of Ally. We work with the care sector, and we provide our resident acoustic monitoring system, which I set up specifically in order to be able to try and help care home staff provide safer care. And we've shown to help reduce falls, reduce hospital admissions, and also give staff back a lot of time to be with the residents that need it. Thank you.
Lovely, thank you. We're really lucky in this session to have people from the adoption side and the development side. So we'll try and manage some of the questions to make sure that we cover both perspectives. So as a starter, I think I'll ask Phil and Alison your perspectives on seeing a whole range of different solutions being developed, and how do you navigate what is useful, and how do you decide which solutions should be taken forward, and how do you really communicate that with the different stakeholders around you? If we go to Phil first.
I think it's a really tricky one, and I think over the last few years, certainly the last 2 more so, but the last 5 years, there's been a significant change and a significant uptick in the level of technology and the level of advancements that's happened within the health and social care sector. So it becomes a lot harder than it was 10 years ago, when the selection was kind of a handful of different providers across 2 or 3 different kind of subcategories of system. Whereas now there's a lot more providers doing a lot more things. So I think for me, it's about understanding, I guess the starting point is about understanding what problem you're trying to solve. There are a lot of providers out there that do one thing, and there are a lot of providers out there that do many. So understanding what problem it is you're trying to solve, what your current capability is internally, and being able to manage that platform, manage the implementation and adoption of that platform, and then looking for a provider that ticks as many of the boxes as you can possibly find. And I think understanding what it is that you're looking for and what it is that you're able to support comes down to people. And for me, it's going out to the organisation. So whether that's an organisation of 30 people or 3,000 people, it's going out to that organisation and talking to them about where their pain points are, what it is that they find difficult, what it is that they would change if they could, blue sky world, and understanding exactly what that means, then understanding what the ROI, the return on investment, is for that same period, and then being able to make sure you maximise that. So that is working closely with whoever your selected provider is, understanding the benefits that you can get out of that, understanding how that both financial and quality and improvement benefit, and then being able to track that to make sure that it is delivering what you expect. And again, all driven by people. So wrapping as much of your team around that as you can and getting them involved will aid from both the selection all the way through to the adoption. So much about people, but also making sure you see a selection of people, of providers that are fitting the bill of what you're expecting to deliver and hoping to deliver.
Brilliant, thank you, Phil. And I think that really ties in with a lot of the findings from the research and those insights. So that's useful to hear. And Alison, are there any contrasting views on that, or would you agree with that? What are your thoughts outside?
No, I would agree with that completely. I think that's a really valid kind of argument and perspective. I think for me, there's a couple of things that I would just want to add to that. Part of the reason that we've been setting up these national and regional networks is to share knowledge and learning so that we can learn what other areas have done, because we know there's a lot of good practice. We know there's a lot of different things going on. And what we want to do is learn from each other. So where someone's perhaps used some particular piece of kit or equipment or system, how effective that's been. So let's learn from each other. Let's look at what's gone well and what could have been done better. So I think that's one area that we really definitely need to get better at doing. I think the other side of it is, I would completely agree in terms of what is the problem that you're trying to fix or trying to enhance, and then what is the best way of solving that. So it's not always about a piece of kit that necessarily already exists. It's about working with providers and developers to actually kind of look at, this is something that we're struggling with, and work it backwards. How do we then look at finding some way of resolving that? And there is not one size that fits all. There's going to be a variety of different solutions, and it's about thinking through the best way to meet that need. So on a very individual basis, it might be something that you can buy off the shelf, if you like, that somebody can then utilize in their own home. It might be a more broader kind of system-based issue that you want to look at, and then it's about the procurement process. So it depends on what exactly the system is that you're looking at, the problem you're trying to solve, as to what the solution potentially might be. But for me, it's very much an issue of not one size fits all.
Brilliant, thank you, Alison. And I think that brings it on really nicely to a question for Nicola and Thomas, which is if we think about that, solving a problem and having your product that you've developed, how much adaptation do you generally find you have to do with different providers, and how do you ensure that you're communicating the benefits of your product adequately for its adoption? Nicola, I might start with you there.
Yeah, I absolutely agree with what Alison's just said, actually. We see our role as developers as being very much one of building partnerships with customers, with commissioners who are customers, in order to work together to identify and prioritize the most pressing needs. Excuse me. I mean, as developers, we're focused, My Life Raft, on person-centered design. And we're very heavily engaged with the population. And we see these partnerships as an opportunity to bridge the needs of the population with the fabric of social care in terms of digital support. you know, so it's working, it's team working, it's working together that will enable some of these challenges to be overcome.
Thank you, Nicola. And Thomas, I know you do quite a lot of work to get data out of your product and your system to really make that case of the benefit. Would you be able to explain a little bit about how you do that and the benefit it provides when you're in these conversations?
Yeah, so really good question. So we definitely have a sort of program from the very first person organization that we communicate with, all the way through to once we're set up and once we're in use, making sure that every stakeholder within that care home or within that company, care home company, is aware of what we're trying to achieve. Like for us, we're very much around transforming how care is provided to residents alone in their rooms and enabling that to be safer, enabling that to be less disruptive from regular checks, and enabling that to essentially be more efficient and personalized from the staff that provide it. But we have a full training and adoption program that introduces the goals of the system, the purpose of the system to each staff member. And then we work through with that provider saying, here's how we're going to be able to show that we've achieved it, because that's really important, right? So take, for example, the fact that we help to prevent falls by alerting staff earlier to a resident who may be thinking about bed exiting because they want to go to the toilet, for example. Well, because you prevented a fall, the fact that you prevented a fall might not be self-evident to a staff member. And so you can only see that from data when you look at what has been going on in that care home for the previous 3 or 6 months to what's happening afterwards. And then also looking through the care notes to see, well, okay, well, how did that happen? And you can see written on it, heard in Ally, so-and-so trying to get out of bed, found them on the edge of the bed, was able to provide assistance. And then you can start to actually build an evidence base to go back to the staff and say, hey, look, you're using a system, it's enabling you to do X. And you can see that before the system was put in, there were this number of falls, and after there were this number of falls. But you have to set a plan about in place with the care home provider in order to make sure that you get that data out of their care planning system, and that you can then go back and present it to all of the stakeholders within the organization. And that really helps from an adoption perspective, and obviously really helps for the organization to understand that they're getting the value out of the system that they originally bought into.
Lovely, thank you. There's a question in chat from Dominic, who's asking about funding available for getting started with different bits of technology, and particularly thinking about bespoke solutions. Alison and Phil, are there sources of funding that you're aware of that can help people with those sorts of problems? Alice or Phil, maybe you first. I see you've unmuted.
I did, but not to be overly helpful, to be honest. I know that there is funding available. I don't know a huge amount about it. I think that funding, I'm not sure that funding is for bespoke solutions as opposed to supporting the onboarding of a solution, but there may be people out there that can contradict me and prove me wrong.
Alison?
So yeah, I mean, I think this is probably a tricky thing that we need to resolve. One of the issues is that often, and I think even within the white paper, some of the funding that's available is based on bid-based basis. So people are having to put bids together quite often at quite short notice to then look at how they can articulate that and access the funding. So it's not always the most conducive way of getting funding, because, you know, it's obviously making sure you've got a bid ready. I mean, one of the things that we're talking about within our networks is looking at what it is that we might want to bid for if a funding opportunity became available, and having those bids ready so that we're ready to go forward for it, because quite often it's a bit of a mad dash at the last minute when you're trying to put a bid together. So there are bids around, but it's about how you access them, and that takes quite a lot of work. I think it's then one of the issues is quite often those bids are usually for pilots, and I think the challenge then is how do you then mainstream that into a system or an organisation. So there are pockets of funding available. I would say the bids are often quite tight timescales, and quite a lot of work to get through that. And that's something that we're trying to again look at in terms of improving the collaborative working to make sure that we've got bids ready, perhaps on a regional or sub-regional basis, but also looking at then what it is we're trying to achieve through that. I think from my own perspective, that's sometimes not always the best way to get to a mainstream position. So it's something I would kind of perhaps want that to be looked at in a bit more.
Thank you, Alison. It sounds like people should get in touch with you to become part of that network and get some support for those bids. There's a really good question from Louise from Lincolnshire County Council, and she's asking how could people navigate the market better outside of just Googling for options. How do you find the solutions? And I think it's also useful to put to Nicola and Thomas to say, how do you get yourselves in front of the right people at the right time? So I might start with Nicola actually, and then we can go round. Oh, you're on mute just now, Nicola. Oh, you're still on mute. I might go to Phil just before.
Sorry.
Oh, we're back on.
Yeah, we're back on. Apologies
okay.
for that. Sorry, could you just repeat the question for me?
So how do you get in front of the right person at the right time, and how do you ensure that people can find you as a solution?
Well, we see our role as building partnerships. You know, as I said earlier, it is very challenging in actual fact, because as a business we do need to scale up quite quickly. So we do sell My Life Raft B2C, which is directly to the public, as well as to commissioners and employers. And the direct to the public sales is quite challenging in terms of, as I say, of scaling up quickly enough to satisfy the business need. Particularly, you know, when there's a level of education involved in self-driven healthcare. So, you know, there's social media, etc., and we've had quite a bit of success on that front, and that will be ongoing, as will PR work, etc., as we launch our companion apps to My Life Raft. With the commissioners, it's much more challenging, because not only ourselves, but from talking to other business owners, some of which actually have gone under now, and yet they had really good products. You know, commissioners are used to commissioning packages of care, you know, and the usual support for the elderly and disabled, etc., because the system's set up to do this. Commissioning digital products is another matter. And as was mentioned in the presentations earlier, and it was lovely to hear it actually, there's clearly a need for digital leadership and change management. I mean, and this has to go right through to the training of assessors to ask questions, and questions being added on assessment forms, etc. But I actually also think that the tech industry carries some responsibility to help with this. We partner with our customers to ensure that we develop to meet the priority needs. But one of the big challenges there is that these are only revealed after a period of time when the data is available. And then to add to the complexity, one size doesn't fit all. Each local authority differs in its problem and need. And as I've said before, as a business, it's vital we can scale quickly. So it's a real challenge. We need commissioners to become business partners and to help, to be open really to accepting perhaps an imperfect solution in the first instance. My Life Raft at the moment, for example, will meet 80% of the need, but each local authority will need to collect data to build the remaining 20%, and also be willing to pay up front. So the budgets have to be there for the product, and to offer resources to work with companies like ours to gain the evidence. We feel that the pressures on local authorities are so great that there's often no option other than for them to crisis manage, and freeing up resource to engage more with digital developers might be difficult, though it would be fruitful in the short term. As I say, I've seen other products disappear, which is a shame, but products like My Life Raft are ready to go, and it's the business partnerships that we need. So it's chicken and the egg. We need the customers. Customers need to change process to enable evaluation and adoption of digital solutions. Customers and investors need to be furnished with the hard data about cost savings before they'll commit. If the commissioners worked with digital developers, this will unlock funding. And I think the UK has a great chance here if we all commit to this, to be world leaders in digital healthcare support chains. So yes, challenging, but I believe we'll all get there.
Thank you, Nicola. I do hope you're right. Alison, it would be really interesting to hear your perspective next.
Yeah, I mean, I agree with what Nicola said. I think it is very challenging. It is very difficult. I think there's an element of that kind of working together nature. So certainly in our own area in the North East, we're looking to get to develop a framework so that we've got kind of people who can be on that framework, so that when we're looking at solutions, we've got some procurement process that we can use. Our internal systems in local authorities are complex, and that does make it difficult for both us to move forward, but also for developers to kind of to link in with us. So I wouldn't deny that in any way, shape or form. So the more we can do to improve those frameworks that we can have so that people can be part of that is the better. I think it comes down to, again, looking at what is the solution that your problem that you're trying to resolve, and then what's the best fit in terms of a solution to that. Nicola's right, we won't have one piece of kit that will do everything. So it's about being realistic about what you can achieve. I think there is definitely something about the way that we commission. I've been saying this a few times recently, people are our biggest resource, but they're also our scariest resource. So, we rely heavily in the social care network on people providing a service to people, and that's huge, and we don't want to lose sight of that. But the technology can enable us to do things a bit smarter and a bit better, so that actually when people need a service, they get a person-based service at the right time. But then where appropriate, there's a technology solution that can actually free up some of the people time to be more effective where it actually is needed. So it's a real challenge for us, and our way we commission is definitely an issue, because we need our providers, and by our providers I mean our kind of people-based care services, to really adopt a lot of the technology that we're looking at and wanting to use. But we also need our customers to actually feel confident in using that, and that again, it can be a challenge in terms of that, taking that step, that leap of faith, if you like, to actually say this is something that we think will work and will support somebody safely, and we need the confidence to be able to do that. So how we commission and how we work together more jointly to look at our commissioning arrangements are probably some of the solutions, but absolutely I appreciate it. It's a difficult one to negotiate.
Thank you, and that leads us on really well to the next question, because I'm not going to ask every question to everyone on the panel, because we won't get through as much that way. But if we think of those people-based elements of care and how different people provide the services alongside technology, how do you ensure that the technology that you procure is being effective in delivery, and how do you make sure that you can measure that and communicate it around? And I think I'll direct that one to Phil initially.
I think for me, similar to the last conversation, actually, in that it's about people again. So understanding what it is that you're trying to achieve, and then being able to find your right stakeholders internally and externally, and making sure that you're communicating regularly with those. And that might be investors, that might be the solution provider, it might be a local authority, it might be your the people that you care for. But it will always also be the people that you employ and the people that are directly in your teams and the teams that are receiving this transformation and this system. And I think actually being able to follow that journey through. So if you engage with those people right at the beginning, at the outset, to understand what it is that you are hoping to achieve, solving their problems, achieving a certain outcome, and that outcome is the right outcome for them, for the business, and has a return on investment that does quantify the cost of which that transformation is going to be, but also has the added benefits that are hard to quantify and have quality benefits and hard to quantify intangible benefits. And being able to track as many of those through as you can and shouting about them along the way, building up the momentum behind you, behind your team, going to the groups that Alison referenced and others and any others that you're in, and talking about those and being a bit probably more honest than people are used to be about how your transformation is going, but also being evangelical about what it is that you're going through, how good it is, how bad it is, what the challenges are, and help kind of spread the word, for want of a better phrase. But also communicating that internally and consistently is probably the key to making some of those things happen, as much as it is actually doing it. If you can get people in your organization and on the periphery of your organization to support it and make it happen, want it to happen, then it's much more likely to deliver the return on investment that you're hoping for and see the improvements and the digitization adopted in the way in which you hope.
Thank you, Phil. And I'm going to go over to Thomas to ask for a follow-up on that. And how do you ensure that those insights are communicated to people that procure Ali as a solution?
So I just like to say I really agree with Phil on it. It's both really important to communicate how well things are going, but it's also quite important to be really open and honest about where things haven't been exactly right. If we work with larger providers that have 20, 30 odds care homes, every care home is unique. And that's in terms of the staff, in terms of the residents, in terms of how we approach adoption, and the adoption of our system is key in terms of getting the results right. So I think it's really important to always communicate back up the lines on where the failings are. For example, we set up with one of the providers that we work with, we have monthly meetings with new homes that we set up, involving the care homes that are already established and some champions that are involved within there, so that the staff can collaborate on how they use our system and get the most out of it. That's really beneficial just in terms of communicating the benefits themselves. But like I said, we always make sure that we go back from what the staff have said, how they're using it, and always try and bring it back into terms of stats and what we've seen through the digital care record systems and through our own system as well, and make sure that information is propagated through. But at the same time, you need to have learnings on where things can be improved, and you get that from a knowledge base. And I'm talking about more through care home providers, but when you work with an ICS now or across multiple different providers, I don't think there's any reason why you can't share that knowledge and share that information across those providers in a mutually beneficial way, in my view.
I agree, and I think just to kind of add to that, one of the things that I've seen in the past and experienced in the past is a mutual misunderstanding between the care provider and the solution provider, in the assumption that the care provider will know everything about tech and will be able to understand the language, and vice versa. And that from the offset creates a huge gap between expectations on both halves. And having an approach like you've just described, Thomas, as a solution provider is going to benefit everyone across the piece, and being able to have that kind of business partner relationship. And I know, Nicola, you've mentioned working in partnership, being able to do that from the offset and continue that through the implementation to deployment, and then, all being well, beyond that as well, is going to do nothing but good things.
Yeah. You can't be a solution that's one, you know, our technology and our system works as a system that you use, but how it's adopted and how people take it on and how people review it and use it and feel the benefit is always slightly different in every organization. And what that looks like from an ROI is also slightly different. Like, you know, just because we help staff have more time to care doesn't necessarily mean that you're going to utilize it every single time in the same way in every single organization. There are going to be different business pressures, and you're going to put it in different areas. The staff are going to benefit in different ways. And, you know, us is not just about the technology being adopted, but it's about the business benefiting. And unless you are aware of where you can extract those benefits out of, you know, simply if you give staff more time, the question is then what are you going to do with it? How are you going to invest that back in your business, right? It's just a simple one. And learnings across multiple providers in a collaborative forum really has helped, definitely.
Brilliant. Thank you all. We've rapidly run out of time. It's been a fantastic session across all the different sessions that we've had this afternoon. So if we were in a room, we would have a nice round of applause for everyone who's contributed today. So I'd just like to say a huge thank you to everyone who has presented across the NHS Transformation Directorate, Ipsos MORI, IPC, the case studies, and our panelists as well. It's been a really fantastic afternoon, and I'm sure that everyone in the audience has taken a lot away and will definitely be engaged in the follow-ups. So thank you all very much for joining us, and please do look out for more events on the horizon, both from FCC and from the partners today that we've seen. So thank you all, and see you soon.